Welcome back to Close Up. It's a bill with a fun name, Momnibus 2.0. That's Mom plus Omnibus. But it deals with a very serious topic, and that is the mental health of new mothers. Here this morning to discuss this bipartisan legislation are State Senators Denise Ricciardi of Bedford and Senator Sue Prentice of Lebanon. Thanks so much for joining us, Senators.
Thank you for having us.
Thank you for having me.
Senator Ricciardi, let's start with you and the motivation behind this bill. You know, everyone wants to celebrate mom and new baby and all of these things and the miracle that is childbirth. But the reality is, once that happens, there are actually serious gaps in the mental health care system. Explain.
That's correct. You know, when I came to the state legislature, one of the most important things to me was the wellness of our New Hampshire families. And that's why this bill is so important. When a lot of moms have a baby, they're expected to have joy and happiness, but there's a lot of mental postpartum depression, and those gaps are very serious. And the beauty of this bill is that it fixes a lot of those gaps. We had so many people come to us and tell us that this is a serious issue, and we listened and we fixed it.
Now, Senator Prentice, you've worked in healthcare, you've been a first responder. You know, explain, particularly in rural parts of New Hampshire, what we've seen over the last 2 decades in terms of the access to maternal care and birthing centers broadly and mental health.
Great. So in the last 2 decades, we've seen 11 labor and delivery units out of 26 acute care hospitals actually close. So deliveries have become a regional activity versus a local activity, and what that does is it also affects the ability for moms when they're getting ready to have their babies as well as after they have their babies to access follow-up services, including mental health care. So these gaps in access, some refer to them as maternity deserts, have posed problems for not only the moms, but the providers who are working so closely to safely support that delivery and any potential complications.
Yeah, compounding the isolation problem as well. Senator Ricciardi, you know, one of the key points in Momnibus 2.0, screening moms for depression at the baby's well checks. Explain how this will work.
Well, this is really great because so many of the moms, they don't take care of themselves and they don't show up to go to their regular doctor, and they're the most vulnerable moms of all. So now with this bill, when they take their baby to the pediatrician, they will be screened for postpartum depression and they will be able to bill the baby's provider.
Senator Prentice, continuing on with the rural aspect of this, because of the lack of access, because of the distance that moms now have to travel for the care and to deliver their baby, why is it important in this bill to have this added training for some of the first responders who might be dealing with a complicated pregnancy situation when mom calls and says, I'm not going to be able to make it to the hospital on my own?
So what complicates this is when you think about the more urban parts of our states, there's public transportation. Not everybody has a car, but there's public transportation, and you can get to where you need to go, including your doctor's appointments or even to deliver your baby. What happens in terms of isolation and access to health care in the more rural areas is it becomes much more limiting because there isn't public transportation, because folks might not have a car. So the emergency medical services system becomes that safety net. 3 numbers, 911, you dial when you think that you need help. And that has, so that's a really important part of our overall healthcare system that's often underlooked in these conversations. So by strengthening the training and again, the identification of the moms who are having complicated pregnancies, complicated deliveries, we're going to be able to support them and save their lives as well as the lives of the baby. So it starts with the isolation, it starts with their distance from the hospitals, and what we're trying to do through the primary healthcare safety net of emergency medical services is close that gap and provide overall safety for moms and babies.
So in this case, the paramedic or EMT might be able to identify, hey, wait a second, we might need to get you to, say, a higher level of care than...
Right patient, right place, right time. We use that in so many parts of emergency medical services, including in obstetrical cases. Most deliveries happen without complications, but when they are complicated and you're particularly further away, we need to make sure that these great EMTs in our state have all the tools they need to identify and to direct to the right place.
Senator Ricciardi, what's in this bill in terms of being able to give new moms and parents the opportunity to get to the doctor and to have time off to do it?
Well, there's time to be allowed to leave work unpaid, but you will be able to. When we had testimony from Dr. Howland, one of the biggest topics that she talked about is having patients who need C-sections and won't do it because they can't get the time off. And her comment was, this bill will save lives.
Senator Prentice, on the copay side of things, that's another one, it can be a barrier to access, another thing that might keep mom from making that appointment. What's in this bill on that?
So it basically, it eliminates the copays. So it makes this access in terms of whether you are using Medicaid or you have commercial insurance. This is for all families, all moms. So by eliminating that copay, it just removes just another barrier for that mom to access the health care that she needs, the mental health care in this particular case.
And I'll have you both talk about, home visits. And you've talked about sort of building the community around, new moms. I can remember just as a new dad with my first child, when that first home visiting nurse came, it was almost like a relief, like, oh, okay, we can be told, okay, do this better, or, you're doing this well. It was really great to have that insight coming into the home to help. What's in this bill on that front, Senator?
There will be home visits for up to a year, which will really help the family. What people really need to understand is we can't have our moms struggling. They are sort of the backbone of the family, and it really escalates down to the rest of the family members. We even heard from a daycare provider that she said when she sees moms with postpartum depression that it goes down to the child and has ability to give cognitive and behavioral issues later in life. So having these home care visits will be game-changing and provide such a benefit and fill a really big gap for our families in New Hampshire.
Senator Prentice, your thoughts on the importance of those home visits?
Those, regardless of where you live or what kind of, what family, where you live or your family situation, there's a struggle. It's still new. I thought when I was a new mom, my daughter's 27, I was like, I'm gonna have this baby. I know everything I need to know. And there I was. I had this little baby in my home. And if it wasn't for peers, and this is when we're talking about visiting nursing, we're talking about, visiting services, we're talking about, nursing professionals, but we're also talking about peers, moms who have been in this situation who can come in and say, it's okay that you're unsure, it's okay that you don't know. We're gonna help you and give you the resources that you need to support you through that time so you can build and be prepared to be more out on your own. And if you need a lifeline, you'll have a place to go. You'll have someone to contact.
And this bill does have some peer-to-peer support language in it as well. That's, so as you mentioned, so much of this testimony was the mom was saying it can be so isolating. You're going through this hormone crash that happens after you give birth. And then also so much of the attention then goes to the baby. And not a lot of people are still looking at mom at that point.
Yes, and it does have that peer-to-peer support. It also has a hotline so providers can give the proper care they need and have all the tools in their toolkit. And as a mom myself, my son also 27, I remember it's hard. It's really hard, and having this help is going to fill all of these gaps and strengthen our families here in New Hampshire. I'm very proud of our bill.
Yeah, on the bipartisan side of this, Senator Ricciardi, there's a lot of bills that pass with bipartisan support that don't get a ton of attention. This one is one of the ones where there's agreement and people are looking at what's being done.
Well, I came to the legislature to do the work of the people, not really about the party politics. And in this case, this is about families. It's about moms. I can't imagine anyone not wanting to support family.
Senator Prentice.
And what Senator Ricciardi and I know is that when New Hampshire moms thrive, then New Hampshire babies thrive. And their families do. And their families are part of communities, which are the bedrock, the backbone of this great state. So the work that we're doing together supports all of that and goes right back into building prosperous, inclusive communities in the state of New Hampshire.
Yeah, and you mentioned that, there's a workforce and economy element here too. We talk about moms, but what this really is, these are people who are working, and if things are not going well in their home health life, then that can have an impact on the broader community as well.
Yes, it does help with our workforce and the economy. And the other thing to mention is it's a very nominal cost to the state, and at the end, in the end of it, you'll save money because of prevention. You'll have less medical issues. So I can't say enough about how much this is going to provide for our families here.
And on the economic impact, Senator?
It's one of those times where we see the medical community and the business community come together for the betterment of the workforce, because they know when you're healthy, and you're healthy and you prepare yourself, you're going to go back to work. And that's part of why they've come in on this, is to support families, but to support their workforce. And women are valuable in the workforce. We know that.
All right, Senator Prentice, Senator Ricciardi, thanks so much. And we'll look forward to Momnibus 3.0. We'll see how that goes. All right.
Okay.
Appreciate the time.
Thank you.
And we'll be right back with an effort at the State House to allow the state treasurer to invest in cryptocurrency. Stay with us.